A new report warns climate change is disrupting healthcare delivery across the Pacific, with rising seas, stronger storms and power outages all threatening hospitals and clinics. The Fred Hollows Foundation, which aims to eliminate avoidable blindness in the Pacific, commissioned the report. It was funded by MFAT and found that more resilient, sustainable facilities can help save lives and money. I travelled to the Solomon Islands with the foundation to see the work firsthand. Days like these allow for people to get around easily. Dry conditions and calm seas. When there's heavy rainfall, cyclones or flooding, it makes it tricky to access medical care in a country made up of many islands.
The main transport would be by boat. And trying to get a blind person onto a boat, thinking of that at first is scary for them. And if the weather is bad and the seas are rough, even more scarier.
Dr. Carol Peloso says the new report gives teams like hers clearer data on changing weather trends, helping them plan their travel to other provinces. The Fred Hollows Foundation commissioned a regional study assessing their clinics in the Solomon Islands, Papua New Guinea and Vanuatu. It found that solar power, stronger designs, water storage systems and making sure staff are prepared can keep critical health services running when disaster strikes.
Our Pacific partners have identified climate change as the most significant threat to health services in the region, and so we were really keen to do what we can to help address that. It has created some excellent information for advocacy because decision makers in ministries and departments of health can see that these climate resilient design features can improve the service provision and increase services, but also can actually save money.
It estimates by 2040, $1.6 million could be saved on energy costs alone across the 3 clinics. In Honiara's regional eye centre, those features are already paying off.
We had the CEO of the hospital there at the workshop this morning, and one of the things he's very pleased about is their power bills are not affected by the services here at the eye centre because there aren't any power bills. The rest of the hospital is still on grid and of course, those power bills can be quite expensive.
Right next to the regional eye centre, if you come with me to my left over here, this is the country's only hospital in Honiara. It's hooked up to the city's electricity and water supply, which isn't always reliable. So when that goes down, that means there are blackouts here. And that means surgeries, for example, can't go ahead. The eye centre doesn't have such problems.
The roof is just full of solar panels. So that's providing us energy, and it runs our air conditioning in our theatre and keeps all our instruments, from degrading, and it keeps all our equipment in our clinics able to function well, because the lenses on our equipment, they have to be in a certain temperature. So that they don't fog up.
The foundation says those features have enabled hundreds more surgeries every year.
But it's great to see this kind of work showing that the Pacific is also leading in terms of some of the solutions, identifying ways forwards and then applying that.
Because building climate resilient healthcare is more than just well-built clinics. It's about protecting access to care for generations of Pacific families.